Hello everybody, again welcome to the Shepherd's Pie channel where we talk about all issues, the good, the bad, and the ugly. So today, you can see this marks on me. What does that tell you? Now you all know about the virus, coronavirus, right? So I got doctors here to talk about it.
Hello, my name is Christy Gray. I'm an MD PhD. I'm an anesthesiologist and a research scientist.
Yes, and I'm Reginald Gray. I have a PhD. I was trained in immunology, and I am currently a research toxicologist.
Today we wanted to talk to you about the 2019 novel coronavirus. As you may have been hearing, this is a new virus that has shown up in humans. It was originally described in the Wuhan city in China, where there were a cluster of people that had pneumonia, and it was identified to be related to this coronavirus. It is a new virus in people, and the reason that it's a concern is because it has been spreading, and there have been more cases, and those cases have gone even beyond the scope of China, and it's been fairly contagious. And so the concern has been not just that it's contagious and that it's been spreading, but that it has a pretty significant rate of injury. So 80% of the people that get this coronavirus will have pretty minimal symptoms, but 20% will have pretty significant symptoms and will even require going to the hospital for disease. And 1 to 2% of the people that get this virus may even die from it.
So a lot of people are concerned with what are the symptoms of the coronavirus?
There are many symptoms associated with the coronavirus, all of which are associated with respiratory things. So people may have a cough, sore throat, runny nose. They may have GI symptoms like nausea, vomiting, or diarrhea, headache. The things that are most concerning and they tell you to go to the doctor for or to go get assessed would be if you have fever, a cough, and shortness of breath. So if you have those 3 things, then you should be evaluated for infection with the 2019 coronavirus.
Should everybody go to the doctor?
Right. That's the one I didn't want to answer. So I think...
It's a perfect question because
it is the perfect
you've got different
question.
people that are in a different situation. So
absolutely,
you just said previous that they should go to the doctor. So everybody thinks they should go to the doctor when everybody shouldn't have to go to the doctor.
Right. So the reason that you should have to go to the doctor, if you have 3 things, fever, cough, and shortness of breath, you should absolutely go to the doctor. If you have kind of a mild viral illness, meaning you feel a little bit tired or you have aches and pains or you just feel like you're not feeling well, but you're not short of breath, you don't have any fevers,
but what
you
if
could
the person,
isolate yourself.
What if the person has the flu opposed to the coronavirus? You know, like me, I haven't left the country in a year and a half, you know, and so unless I come in contact with someone that has left the country, you know, then it could just be a common cold, correct?
Absolutely.
So I should go to the doctor still for that?
No, you shouldn't, I would say. I mean, but when you start to have more significant symptoms, then you do. So lots of people will get the cold or they'll get flu-like symptoms, but they don't all go to the doctor, right? But those who are having more significant symptoms, those who might be more at risk for severe disease, like older people, people that have heart issues, lung issues, that might be diabetic or cancer patients that are higher risk for infection, then those are the people that should be more vigilant. And if you are not sure, then call your doctor's office and ask them, right? Tell them what symptoms you have. And maybe they'll want you to be seen, or maybe what they'll tell you is to go get evaluated at somewhere that's more specialized. So sometimes it's hard to know. But definitely if you have fever, cough, shortness of breath, you should get evaluated. If it's very mild, then you should isolate yourself until you're feeling better, just so that whatever you have, whether it's coronavirus or something else, doesn't cause problems for other people.
Okay, what about the younger generation, children? You know, how are they affected by the coronavirus? Do you know?
So they seem to be affected, but not as severely as those who are older.
Okay.
So when they look at the people that get serious illness, these are the people that have to go to the hospital, the ones that get pneumonia or respiratory failure and end up on ventilators, or the ones who even have organ failure and might die from this. Those tend to be older people. So the average age of those with pneumonia was like 56 years old. 2/3 of them were men, and many of them...
well, that's not too... It's got to be the man, huh?
Well, everyone's at risk. But when they looked at that population that had pneumonia, 2/3 were men.
Okay.
But they know that people that have a compromised immune system for whatever reason, those people tend to be higher risk, and not just for getting the infection, but for not recovering from it.
Mm-hmm.
Right? Those are the ones who might get
Not being able to
respiratory
clear it,
failure
yeah.
and can't clear it.
Okay. Well, the CDC reported there are 234 cases of the coronavirus here in the United States. What can we do to prevent spreading that further?
So we know, or we think that this is a respiratory disease, right, and passed along by droplets.
Mm-hmm.
So anytime someone coughs or sneezes or exhales, does lots of things, right? Those droplets go into the air,
Mm-hmm.
and they land on surfaces.
I mean, just eating food, though, is the same concept, correctly?
You're
Expelling droplets?
You're expelling droplets,
Okay.
absolutely. And you're expelling them to all kinds of surfaces.
Yeah.
And what happens is then someone else who doesn't have the virus that you have then touches that surface, and then they touch their mucous membranes. They touch their eyes, their nose, their mouth, and then that person gets infected with the coronavirus. So big things would be preventing you from getting those droplets. So try to wipe surfaces that are high touch areas very frequently with cleaning agents, your normal cleaning agents that you would use. Then washing your hands, right? So that if you do touch your eyes, your nose, or your mouth, that your hands are clean and not been contaminated with the coronavirus or any other virus. And then a bigger thing would be to be away from people that are sick. So anyone that's coughing or demonstrating flu-like symptoms or cold-like symptoms or just coughing and sneezing, to be away from them, right? So you should be at least 6 feet away from them.
Mm-hmm.
If you do have the virus, they would tell you to be isolated until your symptoms go away. So you shouldn't be out in public, right? You should ideally be isolated away. If you do have to go out, your doctors will give you a medical mask that you can then wear that will help prevent your droplets from going into the surrounding air or environment. So biggest things would be just prevention. Prevention would be hand washing.
Oh.
And if you can't wash your hands with soap and water, to use an alcohol-based hand sanitizer that should be at least 60%
yep.
concentration or higher.
Yeah.
So frequent hand washing, either with alcohol-based hand sanitizer or soap and water, would be your biggest thing. And then staying away from people that have cough, sneeze, and if you are sick, to isolate yourself.
What about food? We should make sure that the food is cooked well. We shouldn't eat raw eggs, meat of any type.
Absolutely. And then the other thing is just avoiding contact with live farm or wild animals.
Mm-hmm. And then also, what if we don't have any cleaning agents? Could we make up a 10% bleach solution? Just common household bleach.
Sure. I mean, I think people think that whatever you would normally use to clean a surface would be adequate.
Well, what
but
if we
it's
just
10%.
don't have it, you know? And
So an effective antiviral agent would be a 10% bleach solution that you can make up yourself.
Yeah.
It's 1 part bleach, 9 parts water. I think just paying attention to the information that's out there. You can get that through the Center for Disease Control or from the World Health Organization. They update information on this virus as it becomes available, because we still don't know very much about it. I mean, it was just identified in December of 2019, so we're still learning a lot from it. So I would say to just stay informed and to not become panicked, but do your best to do what you can to be preventative and protect yourself and those that are around you by just doing common sense things that we should all do regardless of the coronavirus.
Yes. So wash your hands, use hand sanitizer, and stay safe.
All right, busiafo said the mote you know adie hia kese pa ne se obehohoro onsa and I wonim say eba Africa ana Ghana mostly ana wohoro onsa ye the good chance mu na wahohoro onsa gu nsuo nim ansa na wapepa onsa but yare na eba ne de mesre wa enye ne sa de esese wo ye ne se nsuo ida se obi behwie agu so na wahohoro a manenko uhia running water so na ehohoro na bibia enko medawase. Thank you again for watching and thank you.
You're welcome.